Good day, everyone. This is Chris with the Ancient Scholar. So today what I'm going to do is I'm going to show you a field expedient method for hanging IV piggyback medications. This doesn't involve a pump, and clearly I cannot condone hanging most of our medications without a pump or syringe driver, but this is purely field expedient. And if we're in a situation where perhaps all our pumps have failed, we don't have any other options, this is a potential option. So first of all, piggyback medication, if I administer medication by IV piggyback, what I do is I have a main infusion that we call our main line, our primary infusion. If you can imagine, this is going to my patient. I have the primary infusion. Generally it'll be some sort of isotonic solution. In this case it's 0.9% normal saline, physiologic saline. It could also be Ringer's lactate. However, saline is a really good medication for hanging as our primary line because it generally mixes well with other medications. So I can give a plethora of medications through that. So what we'll do is we'll actually piggyback another medication infusion into our main line, and we'll generally piggyback that through our little Y port here. If you can see the main line, I've got my drip chamber, my port, and of course this would be going to the patient. In this case, let's just say that we have a xylocaine. So maybe I need to hang a xylocaine infusion. So I've prepared my xylocaine. This is actually a 10-drop tubing, but ideally you'd actually want to use micro-drop, 60-drop tubing for any kind of medication. So we'll be administering xylocaine via IV piggyback. So just using some real basic tools that I have out in the field, I've taken a constricting band we use for IV therapy, and I have some, these are actually needle drivers, but you can have curved Kelly clamp, whatever the case may be. And I'm just using this constricting band here, tied onto itself, and now I have my primary line is low. With a piggyback infusion, we actually want the medication being piggybacked up higher, or we risk the chance of the piggyback medication kind of being sucked back up into the main line and not actually delivered to the patient. So now my piggyback medication is higher than my primary line. I have the tubing flushed. Now what I'm going to do is a lot of people will in the hospital. Of course, we have something called a lever lock, which is a needleless device that can lock in there. Let's just assume maybe we don't have that out in the field. Another option, and it's a fairly safe option, it's one I like, is to access this, to connect this, is to actually use an IV catheter. And what we'll do is we'll access the port with an IV catheter. Here I just have an 18 gauge IV catheter. I have my Y port. Obviously I'd be wearing gloves and I'd wipe this with alcohol using good technique. And what I'll do is I'll access this port with the IV like so, and then what I will do is I'll pull the needle out, and the needle will go into sharps, and now I have a needleless system. I don't have to worry about poking myself. I don't have a needle in here. I just have a catheter. And then all I simply have to do is connect a piggyback infusion here, and then just go ahead and, obviously this would be at the patient. I could go ahead and tape that down. Maybe this is on the patient's arm, and maybe their antecubital fossa. Okay, and then I go ahead and initiate my piggyback infusion. Let's say this is a xylocaine infusion. I've mixed 4 milligrams per milliliter concentration. I want to run 2 milligrams a minute. Obviously that is going to be 30 milliliters an hour. On micro drop tubing, that'd be 30 drops a minute. So real easy calculation there. So anyway, this is the field expedient method for initiating and hanging a piggyback infusion of a medication. Thanks, and as always, thanks for hanging in there, guys.